Hi everyone, my name is Sin Ward and this is my agency presentation. So this semester I have been placed at AIDS Alabama for my internship. You can see their logo there in the corner. AIDS Alabama's mission is that it devotes its energy and resources statewide to helping people with HIV and AIDS live healthy, independent lives and works to prevent the spread of HIV. Their vision is to effect systematic change to dramatically improve the lives of people with HIV and AIDS and reduce infection and mortality rates. How they help is that when someone comes into AIDS Alabama for testing and care, they can be rest assured that they will be treated with dignity, respect, and above all, compassion. They help anyone in need of care and they do not discriminate. They are passionate about health equity and believe everyone in their community deserves high quality health care. If a client is HIV positive, they assign them to a social worker who connects them with a continuum of care, which includes medical needs, financial and housing assistance, mental health counseling, nutrition support, peer groups, and transportation. We continue to expand our social services to ensure more people from our community have timely, compassionate access to the health services that they need. Oh. So, AIDS Alabama is dedicated to helping people stay healthy. They have health and wellness programs that they provide. They provide culturally sensitive, LGBTQ friendly services. The LGBTQ and Black communities have been profoundly affected by HIV. So, as part of their comprehensive approach to treatment, education, and prevention of HIV and AIDS, AIDS Alabama provides housing, healthcare services, health insurance premium assistance, and support groups designed to empower community members living with HIV and AIDS. AIDS Alabama also offers comprehensive prevention programs which provide HIV testing and STI testing and treatment, counseling, and outreach to at-risk communities. The programs at AIDS Alabama, they focus on housing, policy, and advocacy, supportive services, HIV/STI prevention, and education and testing, as well as free, and the testing is confidential and free. So that's AIDS Alabama Inc. Then we have El Centro, which is the hub. That provides a safe place that centers the experience of Black and Latinx individuals, but is open to serve everyone, of course. Services include HIV, STI, Hep C, and COVID-19 testing, event space, gym, dance studio, game room, shower, and a computer lab to help with tutoring, internet access, and job placements. So they also have the Living Well Health Clinic. They provide culturally relevant access to PrEP, condoms, other HIV interventions, and some general medical services. Financial assistance is also available for those without insurance. Then the Living Well Outpatient Center, they do mental health services. They do psychiatric assessment, medication monitoring, nursing assessment, individual, family, and group therapy, psychosocial support services, GED and vocational training, treatment adherence, counseling, bilingual case management, substance abuse placement, and assessments for adults. So the program that I specifically am working in this semester is Jasper House. Jasper House provides a residential studio apartment unit based on clients' income. They provide 3 meals and 2 snacks a day to the clients. They have dietitian services to assure that clients are getting the nutrients they need to be healthy and stay healthy. They work with Living Well Outpatient Center under their psychiatrist to assure that all of their clients are getting the right medications and treatment under Jasper House Care. They have a nurse that oversees the MAC Worker program and clients' daily medications and vitals. All Jasper House clients have their medications monitored and distributed to them as prescribed by their physician. They also have a case manager that assists clients in obtaining vital legal documents, transporting clients to appointments, building basic living skills, and linking clients to resources. They have an RDP, which is Rehabilitative Day Program instructor, who facilitates the day program groups from 9 a.m. to 2 p.m. The instructor covers various topics such as basic living skills, mental health awareness, recovery, journaling, health literacy, and cultural awareness, among other things. RDP Activities Coordinator plans daily activities and events. Activities include journaling, painting, Zumba, workouts, walking in the park, going to restaurants, going to movies, or trips to the museum, and much, much more. They do a lot of stuff. It's a great place. So, at the Jasper House, the eligibility requirements: you must be living with HIV, you must be homeless or at risk of becoming homeless, and you must be diagnosed with a serious mental illness. Clients are usually referred to Jasper House by social workers at different places such as homeless shelters, DHR, hospital social workers at hospitals in the area, and especially 1917 Clinic. BAO, Birmingham AIDS Outreach, they refer to our agency as well. And also, if someone comes into Living Well and they think that they might be a good fit at Jasper House, they will send a referral as well. So most of the referrals come from other social workers in other places, and they know about Jasper House. And if they come across a client that they think might be a good fit, they give us a call. So, as an intern at Jasper House, I shadow the agency coordinator, the RDP coordinator, and the RDP instructor as they perform their daily tasks. I have assisted with clinical and case management treatment plans, as well as conducted suicide risk assessments, mental health assessments, violence risk assessments, and biopsychosocial assessments one-on-one with clients under supervision. I have provided case management services under supervision, and I have assisted social workers in completing case management and contact notes for billing purposes, and learned all about how you have to be specific in your documentation for billing, for Medicaid, for insurance, all those things. Really interesting, really important. I also interact with clients individually and in group settings during RDP groups, and I even designed and presented a group to the clients on my own under supervision. So, my experience at Jasper House, my most interesting learning experience so far has been designing my group and presenting it. While I was practicing my presentation in front of my supervisor, I was advised to add a visual illustrative element to my presentation other than the handouts that I had made. And once I presented, I could see why they asked me to do that. So I drew pictures on the board and illustrated it with actual pictures, because I made handouts, but some of our clients actually do not know how to read. And some of them their cognitive ability just works better. They learn better when they see a picture versus seeing a word or hearing someone say words. So it taught me a lot about my perspective and different people's learning styles. And, it really reminded me that every client is unique and that we have to let the clients lead our practice. And that when, you're working with a large group, it's important to present the information multiple ways so that everyone can understand and benefit. What excites me the most about this agency is the fact that all the clients have a serious mental illness. Obviously, I'm not happy about that, but it is very interesting because I'm very interested in mental health and psychology. And it's very exciting to be able to observe clients with relatively rare mental illnesses such as schizophreniform, which you don't see a whole lot. I mean, it's pretty rare, but yet about 90% of the clients at Jasper House are affected by it. So that's really interesting, watching their symptoms, their habits, their behaviors. It's just a wonderful learning experience, once in a lifetime, really. And I think my biggest challenge at the Jasper House will be the fact that most of the staff and clients are people of color. I will have to be sure to self-reflect and stay aware of myself so that I do not accidentally offend or hurt anyone with any words or actions. I would hate to not reflect on myself and my own behaviors and thoughts and beliefs enough to where I would hurt somebody, because I would never want to hurt anyone, especially on the basis of the color of their skin. So I will have to grow in my learning and experience when it comes to cultural competence and humility, and remember to let the clients lead and teach me instead of me leading and teaching them. So that's the end of my presentation. Thank you, guys.